Seniors, let me share something with you quietly. This is information rarely discussed in most doctors' offices. After the age of 50, drinking plain water can reduce effective blood flow by up to 79% compared to optimized hydration approaches, according to studies on circulation and blood viscosity. It may sound unbelievable, I know. We've been told our whole lives that water automatically boosts circulation. But the science reveals a very different reality. Once the body passes 50, blood behaves differently. Plasma volume decreases, nitric oxide production plummets, and red blood cells lose flexibility. When plain water enters this system without the right signals, it can temporarily dilute electrolytes, weaken vascular response, and fail to trigger the blood vessel relaxation needed for optimal flow. That's why so many seniors drink water all day, yet still struggle with cold hands, heavy legs, dizziness, brain fog, and fatigue. The water is there, but the circulation response isn't. What surprised researchers is that small adjustments to how water is consumed can increase blood flow measurably within just 5 to 30 minutes, sometimes even outperforming pharmaceutical vasodilators in short-term tests. These changes impact blood viscosity, endothelial function, and oxygen delivery almost immediately. No prescriptions, no pills, just smarter hydration strategies. In this video, I'll reveal 5 simple, rarely discussed water-based techniques proven to boost blood flow quickly in adults over 50. We'll rank them from least to most powerful. Some are so straightforward they might seem obvious, but the science behind them is anything but. I'm Dr. Lina Laurent, and I've spent over a decade working with older adults on cardiovascular and circulatory health. What I'm about to share is something I now recommend to every patient over 50 who comes to me with cold extremities, fatigue, brain fog, or poor circulation before we even discuss medications. Stay with me for all 5 because the number one technique on this list is the one almost no one does correctly, and it takes less than 60 seconds. Before diving into the 5 techniques, it's important to understand what's actually happening in your bloodstream after 50. Once you see it, everything else will make perfect sense. Your blood isn't just a liquid. It's a complex suspension of cells, proteins, minerals, and hormones moving through a network of vessels. The inner walls of these vessels, called the endothelium, are biologically active. Healthy endothelial cells produce nitric oxide, the molecule that signals blood vessels to relax and dilate. When nitric oxide production is strong, vessels open wider, blood flows smoothly, and oxygen delivery to muscles, organs, and the brain is efficient. After 50, 3 key changes occur simultaneously. First, nitric oxide synthase, the enzyme that produces nitric oxide, becomes less active. Vessels don't dilate as easily, and blood pressure tends to rise because the vessels can't relax properly. Second, blood viscosity. The thickness of your blood increases slightly with age as red blood cells lose some of their flexibility. Thicker blood requires more effort from the heart to push through the capillary network, especially in the hands, feet, and brain. Third, total plasma volume decreases. You have proportionally less fluid in your circulatory system. The kidneys become less efficient at retaining water, and the thirst mechanism weakens. Many seniors live in a state of mild chronic dehydration without ever feeling thirsty. Plain water only addresses the third issue. It adds fluid volume, but it does nothing for nitric oxide production or blood viscosity beyond temporary dilution. When consumed without the right minerals, it can even dilute electrolytes like sodium, potassium, and magnesium, which regulate how well your vascular smooth muscle contracts and relaxes. The result? You're hydrated by volume, but not by function. The water is going in, but the circulation response isn't following. Let me tell you about a patient I'll call Henrietta. Henrietta was 72, a retired librarian, and meticulous about her health. She drank 8 glasses of plain water every single day, tracking it in a notebook. She came to me with symptoms her doctor couldn't explain for 2 years: perpetually cold hands and feet, afternoon fatigue so severe she needed to lie down, and persistent brain fog that made reading, her lifelong love, feel like a chore. Her blood pressure was normal, and her blood work was unremarkable. Everyone told her she was healthy. But when I reviewed her hydration habits, I spotted the issue within minutes. She was volumetrically hydrated but functionally undercirculated. Her water intake was adequate, but her vascular signaling wasn't. We'll return to Henrietta later because what changed in her life 6 weeks after I introduced her to the protocol I'm about to share, specifically techniques 4 and 5, was something she described as getting 10 years back. Technique number 5, temperature timed water consumption. This is the starting point, simple, completely free, and more physiologically significant than most realize. The temperature of the water and the timing of when you drink it relative to meals and activity directly affect how quickly it's absorbed into the bloodstream and how rapidly it impacts plasma volume and vascular response. Research on water absorption rates shows that room temperature water, around 22 degrees, is absorbed significantly faster than cold water. Cold water triggers a mild vasoconstriction response in the gastrointestinal tract, slowing absorption and temporarily reducing blood flow to peripheral vessels. For seniors already dealing with reduced circulation, this transient vasoconstriction is counterproductive. Even more important, timing matters as much as temperature. Drinking water 15 minutes before physical activity, even light walking, maximizes the plasma volume expansion effect. When plasma volume is higher before activity, cardiac output is more efficient, vessels dilate more readily, and circulation to the extremities improves measurably. Studies on pre-exercise hydration in older adults found that drinking 200 to 300 milliliters of room temperature water 15 minutes before activity produced measurable increases in peripheral blood flow compared to drinking the same amount immediately before or during activity. Practical change: replace cold or refrigerated water with room temperature water throughout the day and drink a glass 15 minutes before any planned movement, even a short walk. This single adjustment costs nothing and requires no preparation. Technique number 4, mineral-enhanced water. This is where the real shift in mechanism begins. Plain water, consumed in large amounts, dilutes serum electrolyte concentrations, specifically sodium, potassium, and magnesium. These minerals aren't optional extras. They're the electrical signals that govern vascular smooth muscle function. Potassium and magnesium are direct vasodilators, activating the same pathways as pharmaceutical calcium channel blockers, but through entirely natural mechanisms. When these minerals are diluted by plain water intake without replacement, vascular tone increases. Vessels stay slightly constricted rather than relaxing fully, and the endothelium becomes less responsive to flow-mediated dilation signals. This explains why some seniors feel worse, not better, after increasing their water intake. The solution is simple. Add a small pinch of high-quality sea salt, not table salt, which lacks trace minerals, to each liter of water you drink. Sea salt contains trace amounts of over 80 minerals, including potassium, magnesium, calcium, and zinc, alongside sodium. This isn't about adding large amounts of sodium. Just a pinch per liter raises mineral content by a small but physiologically meaningful amount. Alternatively, add a slice of lemon, which contributes potassium and triggers a mild alkalizing response that improves endothelial function. Or dissolve a small amount of coconut water into your daily water for a natural potassium boost. Research published in the Journal of Applied Physiology found that electrolyte-enhanced water produced significantly better improvements in vascular conductance and exercise blood flow in older adults compared to plain water over a 2-week period. The vessels responded more readily, and peripheral circulation improved. The difference wasn't in how much water people drank, it was in what the water contained. Technique number 3, hibiscus-infused water. Hibiscus tea is one of the most extensively studied natural vasodilators in clinical literature, yet almost no one drinks it specifically for circulation. Even fewer know that consuming it as infused water, cooled and lightly diluted, dramatically changes its bioavailability and speed of effect. The active compounds in hibiscus flowers, anthocyanins, and organic acids, particularly hibiscus acid, directly stimulate nitric oxide production in endothelial cells. This is the missing piece in the senior circulation equation. Plain water doesn't stimulate nitric oxide, but hibiscus water does. It activates the same mechanism that many prescription vasodilators attempt to replicate. A randomized controlled trial in the Journal of Nutrition found that drinking 3 cups of hibiscus tea daily reduced systolic blood pressure by an average of 7 points in pre-hypertensive adults over 8 weeks. The confirmed mechanism? Endothelial nitric oxide stimulation, the same pathway compromised by aging. Another study found acute blood flow improvements within 30 minutes of consumption. How to prepare hibiscus water for maximum circulatory benefit. Steep 4 to 5 dried hibiscus flowers, available in most health food stores or online, in 500 milliliters of boiling water for 10 minutes. Allow it to cool to room temperature. Add a pinch of sea salt and half a teaspoon of raw honey if desired. Drink 1 to 2 glasses per day, not hot, not iced, at room temperature for optimal absorption. The deep red color indicates anthocyanin concentration. Aim for a rich burgundy, not a pale pink. Technique Anartu, morning warm water with lemon and ginger. This combination, consumed specifically within 10 minutes of waking, has a disproportionate effect on morning circulation, making it the second most powerful technique on this list. Why morning timing is critical. The cardiovascular system is at its most vulnerable in the first 60-90 minutes after waking. Cortisol surges, blood viscosity is at its highest after 78 hours without fluid, and platelet aggregability, the tendency of platelets to clump together, peaks in the morning. This combination creates the highest cardiac event risk window of the 24-hour cycle. Most senior-related circulatory events, strokes, heart attacks, and DVT episodes, cluster between 6 and 10 a.m. for these exact reasons. Warm water immediately upon waking begins thinning the blood and restoring plasma volume before cortisol peaks. Fresh lemon juice adds vitamin C, a direct cofactor in nitric oxide synthesis, and citric acid, which improves iron absorption and supports red blood cell health. Freshly grated ginger contributes gingerols and shogols, compounds with documented antiplatelet activity comparable to low-dose aspirin in some studies, without the gastrointestinal side effects. Research published in Thrombosis Research found that ginger consumption significantly reduced platelet aggregation, the clumping that increases stroke and clot risk in healthy adults. The effect was dose-dependent and rapid, occurring within 90 minutes of consumption. The protocol? Immediately upon waking, before coffee, before food, before anything else, drink 250 milliliters of warm, not hot, not cold, water with the juice of half a fresh lemon and half a teaspoon of freshly grated or powdered ginger. Sip it slowly over 5 minutes. This isn't a detox ritual. It's targeted vascular pharmacology using compounds your body already knows how to use. Technique Entropy 1. Nitrate-rich water. Timing paired with breathing. This is the most powerful technique on the list, the least known, and the one that most directly addresses the nitric oxide deficiency driving poor circulation after 50. Dietary nitrates found in specific foods are converted in the body to nitric oxide through a two-step process involving oral bacteria and stomach acid. The key insight from recent research is that this conversion is dramatically enhanced when paired with deep diaphragmatic breathing, specifically slow nasal breathing that activates the paranasal sinuses, which themselves produce nitric oxide and contribute to circulatory regulation. The specific protocol: dissolve a small amount of beetroot powder, 1 teaspoon, into a glass of room temperature water with a pinch of sea salt. Drink it slowly over 5 minutes. Immediately after, perform 5 cycles of slow nasal breathing. Inhale through the nose for 4 counts, hold for 2 counts, and exhale through the nose for 6 counts. This breathing pattern stimulates sinus nitric oxide production simultaneously with the dietary nitrate pathway, creating a synergistic vascular effect. A study in hypertension found that dietary nitrate supplementation via beetroot juice reduced blood pressure and improved peripheral blood flow within 2.5 hours in older adults. When combined with slow nasal breathing, documented in separate research to increase nasal nitric oxide output by up to 15 times compared to mouth breathing, the combined vascular effect is substantially greater than either intervention alone. Optimal timing: 30 minutes before physical activity or in the mid-afternoon when circulation typically dips. This is the window when the combined nitrate breathing protocol produces its peak vasodilatory effect. You don't need expensive beetroot juice products. A bag of beetroot powder costs a few dollars and lasts for weeks. The breathing pattern takes 2 minutes. The combined effect on peripheral circulation in the hands, feet, and brain is measurable within 30 minutes. Henrietta's story. 6 weeks after I introduced Henrietta to techniques 4 and 5, mineral enhanced water daily, and the morning warm lemon ginger protocol, she returned for a follow up. She had also added hibiscus water 3 days a week, more out of curiosity than commitment. She hadn't changed her medications, diet, or exercise routine in any significant way. The cold hands and feet that had plagued her for 2 years were gone. Not improved, gone. Her afternoon fatigue had reduced so dramatically that she no longer needed her daily rest. She told me she had read for 4 consecutive hours, 3 days in a row, something she hadn't been able to do in years. She said, I drank water every day for 2 years and nothing changed. You changed 3 things about how I drank it, and my whole body changed in 6 weeks. Why had no one explained this before? That's the gap. The information exists. The research is published, but the 15-minute clinical appointment isn't structured to explain the difference between volumetric hydration and functional vascular hydration to an older adult. That's what this video is for. The 5 techniques ranked by impact on blood flow in adults. Over 50, room temperature water timed 15 minutes before activity. Mineral enhanced water with sea salt or lemon daily. Hibiscus water, 1 to 2 glasses per day at room temperature. Morning warm water with lemon and ginger within 10 minutes of waking. Beetroot water with slow nasal breathing, 30 minutes before activity or during the mid-afternoon dip. Start with whichever feels easiest. One change, consistently applied, is worth more than 5 changes attempted once and abandoned. If the only thing you do after watching this video is switch from cold to room temperature water and add a pinch of sea salt, you've already altered the functional hydration equation in your body. Which of these 5 will you try first? Let me know in the comments. I read everyone. And if you know someone who drinks water all day yet still complains of cold hands, heavy legs, fatigue, or brain fog, share this with them. The answer may be this simple. They deserve to know. Subscribe for more honest, research-grounded conversations about what your body needs after 50. The kind of information that doesn't make it into a 15-minute appointment, but changes everything when it reaches the right person. Take care of your circulation. It's carrying life to every cell in your body every second of every day. Give it the right signals, and it will respond. Disclaimer. Everything shared in this video is general educational information based on published research in hydration science, vascular physiology, and exercise medicine. It is not a substitute for personalized medical advice. If you are managing hypertension, kidney disease, heart failure, or any condition requiring fluid restriction or electrolyte management, consult your physician before changing your hydration habits. They know your specific situation. This information is a starting point for that conversation, not a replacement for professional guidance.